Hello there. Ever wondered what Medicare is all about? Let's talk about it. Now, before I proceed, just a quick note. I'm a licensed registered financial advisor with Blue Aris, and this content is for educational purposes only. Now, let's get back to our topic. Before we get into the meat of the content, I'd like to make some disclosures. Number one, as a licensed advisor, I'm a consultant of Medicare, but I'm not a licensed agent of Medicare. What's the difference and why is it important to understand this point? Since I don't receive any commissions, I give you unbiased advice on which Medicare plan may be the best for you. However, most Medicare agents get paid on commissions when they sell Medicare policies. Now, I believe most agents are honest, but some may not be, and it's known that some have signed up clients in plans that may not be in the best interest of the clients due to commission biases, and perhaps they were making higher commissions selling one plan versus the other. An important point to note is that you as a consumer should never pay a commission to a Medicare agent, as I believe they get compensated by insurance company. Therefore, it's important to consult with a fee-only financial advisor first before contacting the insurance agent, for this is a very important decision in your life that can have dire consequences if right decision is not made for choosing your Medicare plan. Now let's proceed to understanding of the basis of Medicare. Number one, what is Medicare? Medicare is a federal health insurance program for people in the United States ages 65 plus and individuals under 65 with certain disabilities. Number two, Medicare is made up of four parts: Part A, Part B, Part C, and Part D. Now, Part A of Medicare covers hospital coverage. Usually it's free with a yearly deductible. Part B covers doctor's visit, labs, outpatients, and there's a monthly premium to it. Part C is sort of completely separate. It's Medicare Advantage, combines A, B, and often includes D with dental vision coverage, and is offered by private insurance companies such as United Healthcare or Humana, perhaps someone else. As I said, Part D is your prescription drug plan. When you sign up for Medicare, you have two options. You can go with traditional Medicare, which is Part A, B, and D, or Medicare Advantage. The traditional covers you 80%. Therefore, you need additional insurance to cover the remaining 20%, which is covered by the supplemental policy, also called Medigap. Now, if you're on Social Security disability, then Medigap is covered by Medicaid. The previously mentioned Medicare Advantage, as I said, is covered by the private insurance company and is completely separate from the traditional. What are the key enrollment periods? The initial enrollment starts 3 months before to 3 months after your 65th birthday. General enrollment begins January 1st to March 31st annually. This is typically for people who have not signed up for Medicare Part B. Medicare Advantage open plan is similar. It starts from January 1st to March 31st. The open enrollment is from October 15th to December 7th. This is for existing Medicare beneficiaries so that they can switch plans. Now, there are penalties for not signing up properly. For instance, for Part B, there's a 10% lifetime penalty per 12 months if delayed, and if you don't have any other credible coverage. Part D is 1% per month without coverage after eligibility. Another critical point is signing up for Medigap and underwriting, which is, as I said, supplemental policy. If you're signing up for Medigap supplemental policy with traditional Medicare, for the first time, you're guaranteed a sign up for 6 months after enrolling in Part B at 65 plus. After that, Healthcare underwriting is required unless you qualify for special protections in some states, which is Vermont, Connecticut, New York, Maine, and Massachusetts. And these states offer switching with no underwriting. Number 4, Medicare income and taxes. For Medicare, you should be aware of IRMA. IRMA is the income-related monthly adjustment amounts for higher income. So basically, if you have a higher income, you pay more premium for Part B, and Part D. Therefore, if you're doing any Roth conversions, that can be aware that can cause an IRMA spikes. Here are some tips to remember. For Medicare, doesn't cover long-term care, so plan accordingly. For long-term care, don't confuse it with Medicare, and you need a separate insurance. If you're not sure, reach out to us and we can help you out. Medicare process and enrollment is complex, and it's really challenging to cover all the details in one short session. I've provided you as much information as I could, but it's perhaps not enough. So if you have any questions, please put them in the comments or reach out directly to me on my website. The link is in the bio. Thank you very much for listening, and don't forget to like and subscribe if you like the content. Thank you.